Often in life, people struggle with back pain, but especially pain that radiates down the legs, that travels down the legs from the back. And in that instance, sometimes in order to relieve pressure from the nerves and relieve their pain, we have to do what's called a fusion procedure. The PTP fusion, or the prone Transpsoas fusion, is similar to other fusions, except that we are able to access the disc from the side and while the patient's in one position, rather than doing more than one position to do the procedure to help the fusion. The benefit to going to the side is that you can use a smaller incision and less muscle damage. We essentially just spread the muscle and we get to the disc space versus actually removing muscle. And in that case, patients have less postoperative pain, less bleeding, and typically a faster recovery. The major steps to doing this procedure involves making a small incision on the side where we can remove the disc and put a spacer to help our fusion, and then putting screws from the back to help our fusion and help lock the interbody in place. The recovery process after a surgery like this is typically at least one night in the hospital, and you'll head out the next morning as long as everything is going okay. We'll have physical therapy see you the next morning and make sure that you feel comfortable to go home. Occasionally, someone will stay an extra night, but typically you're in the hospital for less than 2 days. An example of a patient that I had is one who had pain from his back all the way down to his foot. He was not able to move his feet, his right foot in particular, so he couldn't drive a car. He came in after trying a bunch of different non-operative treatments, including injections, physical therapy, medications, and eventually we ended up doing surgery. The next morning, he had full function back in his foot, he was able to walk, and he left immediately the next day as soon as he could. I saw him back in the office, and he was back to doing all of his daily activities. He was already back to work, which actually involved driving a truck for a living. So for him, it wasn't just getting back to his daily activities, it was actually his work as well. It was very rewarding to see him back so quickly to his job and what he enjoys doing. I think for me, it means a lot when a patient comes in such debilitating pain or not able to function like they want to, and I'm able to give them the ability to get back to what they enjoy doing, whether that's work or hobbies or just spending time with their grandchildren. And that's the most rewarding thing for me.
Griffin Health, empowering people, advancing care.